Greetings and welcome to the International Pediatric Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Aaron Karn-Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along.
Welcome to IPSS podcast. I'm Elaine Ng, a pediatric anesthesiologist based in Toronto, Canada. We have Dr. Sujatha Thyagarajan today. She is a clinical lead consultant in the Pediatric Intensive Care Unit at Aster RV Hospital in Bangalore in India, which is in the southern part of India. I met her through IPSS. She's a board member. She was the founder of PediSTARS India. And so I was very excited to hear about what she's done. So what is PediSTARS? It's a pretty cool acronym. Pediatric Simulation Training and Research Society of India was established in August 2013. So they've pulled a lot of people together in the country, support multidisciplinary simulation-based interventions to provide care for children. So Sujatha, can you tell us, what did you do before there was PediSTARS, and then you were one of the founding members? Tell us about that.
Yes, thank you, Elaine, and thanks for this opportunity for doing this podcast. I trained in the UK, and then I relocated in 2011. So I was used to simulation-based training, and I received training to become a trainer as well in the UK. So when I first came here, so somewhere between 2011 to 2012, the situation was people were asking, what is simulation? Did you say stimulation? Are you saying we need to learn from mannequins? Why do we need mannequins? This is India. We have real patients. It's a waste of clinical time doing simulation in hospital. And then we said, what about errors? And they said errors were really a matter of bad luck. So that was the situation when we actually started, when I came to India. We didn't have real mannequins to practice on. The only kind of simulation that people spoke about was doing the PALS and the life support courses. That was simulation that they thought about at that point of time. When we kind of, started and I wanted to do some kind of in situ simulation within my hospital, I had to start with pillows, in fact. And I made them kind of imagine that, okay, this is a patient. Now let us start, so the briefing and all of that. And I used to do my video recording of these events. I used kind of, some of the ancillary staff to pretend like that they're seizing, brief them, and then manage the situation, the emergencies, things like that. So meanwhile, I didn't know much about my co-founders, who are Dr. Rakshay Shetty and Dr. Gitanjali Ramachandra. And they were based in Hyderabad, which was also in south of India at that time. So Rakshay trained at Sick Kids and Gitanjali in the UK. Both are pediatric intensivists. So they tried to conduct a national workshop on simulation. And they took help from their contacts from the UK and Canada. So they conducted the first simulation workshop here. And they struggled quite a lot trying to get the organization done and get the people understand the importance of simulation. But it was a starting point. I think on one of the days when I was using these pillows, I was very frustrated. I was like thinking, no, there should be a better way to solve this problem. So I wrote to IPSS at that time. I was looking, and it is, let me tell you, November 2012, I guess. And David Grant was the president at that time. So I wrote a very angry email to them to say, how can you call yourself an international pediatric society and you have no presence in a big country like India, where there is a real need for simulation. And then I didn't hear anything from them, but suddenly I got a call, like within couple of months, from Mark Orbach, actually. He was organizing the IPSSW at New York, I think. And then he rang up and said, well, you seem to have sent a very angry mail. Just let us know what is the situation. And I said, this is the situation. And I said, I don't even know if there are any people in India who are doing simulation. And then he connected me to Rakshay and to Gitanjali at that time because they were locally organizing. So I'd never seen them at all, but I was liaising with them. So me and Rakshay, we kind of discussed the common problems, and then Mark asked us to come and represent ourselves in IPSSW, stating the problems. So we did a survey and then used my pillow itself and did a simulation there. And then I wrote a poster about it and I had done some videos about it. I happened to go to UK subsequently. So I think in April, May, when we presented it, we had our presentation and Raksha came and presented on our behalf. And I met David Grant in UK and I showed my videos and he was so fascinated. And then he asked me, what do you think we should be doing? Like, how can we support India? What can we do? And I just kind of went back to my room. I thought about it and then I made that like weird phone call to Rakshay and I said, you know what? Rakshay was trying very hard to try and associate and get the pediatric societies in India to form a simulation to kind of support simulation. And they didn't understand much about simulation at that time. So it was difficult. And so we decided, I gave the weird idea to say that, you know what, we need to put a society of our own. And then we will actually get the support of IPSS because I met David Grant. Let us get some affiliations and then we'll get some mentorship and then we'll try and grow the society. And let's see what happens. So that's how the idea floated. We started with 3 people. So just the 3 co-founders. And then we sat down and we understood what the rules in the society was. We formed all the necessary paperwork. So Rakshay did a lot of hard work getting all the formalities of forming a society. And then we connected with, with IPSS at that time. And the journey started like that. So that's how PediSTARS formed. We kind of had to name something like very interesting. And in fact, PediSTARS name was like, as an acronym was formed in the back of my car. So we wanted like the key things. So that's how PediSTARS was formed. Yeah.
Wow, must have been a lot of growing pains. I think some of you became an IPSS fellow as well.
Yes. So the way it happened was when we formed the society, the real growth pains started then because 3 people can't run we can't influence the entire country. So as it happens, we try to use our own colleagues and try to like motivate them. And we try to conduct a workshop in one of the national conferences. And at that time, it was a major, major disaster. And I felt like if this is the way we are going to spread simulation and send the wrong message, it's not going to work. So I still remember in the food queue, we had Dr. Vinay Nadkarni. He was there in that conference and he was just curious to see what these Indian people are doing about simulation. He was like the big boss of simulation at that time. And he was observing that he had seen what had happened in the conference when we shared our details in the IPSS. And he really wanted to help us. So he was genuinely curious about our performance and he noticed, there was a long food queue. And he just told me, so I see that you seem to be very upset about what has happened. And I said, no, this is not the way we need to do. And then he said, so what do you think will help? He asked me one question. I said, no, we need trained experts. And the trained experts are abroad. They're not there in my country. And we can't afford to bring them here because it's a lot of money. We can't really kind of get them here. How are we going to grow our country? It's going to take a long time. That's the real thing. And then he asked, so what do you think is the vision for your country? Like, well, how do you think you want to do it? So I said, across the country, at least in the 4 directions of the country, we want to identify some key educationists whom we can give simulation based training, who can influence and then spread it. So we want to create a faculty base. They can spread the simulation, and that's what is our vision. And that's the first thing we need to do. And then, at the tip of his like fingertips, he just like messaged a few people from IPSS, and like 13 people said, yes, we are ready to come with our own money to come and help in India and do this. So that's how we conducted our first workshop. We came to IPSS in 2014 and formed the official affiliation with IPSS. And November 2014, many people, like nearly, I think, 11 or 13 people from IPSS came to India, and we conducted our first workshop of faculty development. So it was a big journey which started there. And then through the support, every year, even to this day, we've had international members coming to our country, and we have a national conference called Simulus. And every year, we have international faculty coming on their own to come and support our country and be part of our faculty development program and the conference. So they influence us, they inspire us, and they help us take us to the next level. So that's how we kind of handled it. The first conference was very challenging for us because there were many people who were non-believers. They thought
But they
that we
still
were here.
came.
Yeah, they came, but they were curious, and
Okay.
they were like, there were a lot of allegations to say,
Yes.
you're here, out here to sell the mannequins, which are expensive. You're not understanding how education in India has to be, and all the rest. But our international faculty were very gracious. They understood how to handle the naysayers. And by the end of the workshop, we had all of them who converted and became big proponents of simulation. And that's how our journey started. So the growth pains there we have. And then
Right.
through the years, we had all these faculty development ongoing. We had key institutions such as CMC Vellore, PGI Chandigarh, AIMS, various AIMS institutes across the country who have kind of supported this event and helped us reach out to as many educators as possible every year. So that's how we have been able to kind of sustain our growth within India. And we have conducted various small workshops to reach out to as many people as possible to make sure that simulation is a better way of learning acute care. So we have lots of workshops such as the STEP workshop, the NeoSim, the Success. So various such workshops helped us to reach all the young trainees and the district
That's the key,
pediatricians.
right? So young trainees,
Correct.
so that they
Yeah.
can continue with all this. What about the learners? I mean, you started with pillows with a smiley face or just a pillow, and they
Just the
love this,
pillow. Yeah.
right?
Yeah. I mean, like they understood, and then, like, preparing the patients. I didn't know the terms at that time. It's called standardized patient. We just asked them, like, I want you to jerk like this so that we'll know how
Yes.
these perform. At this point, I want you to stop when they give this medicine. If they don't give the oxygen, we are going to show them this is what it is. We didn't have any apps. I used to use the calendar, and I used to draw the waveforms and keep it as a flip chart to say, okay, so you've connected to the monitor and this is what you see. So what you do, and then the next flip chart comes. So that's how I used to conduct in my center. But there were people who just kind of eventually we took the help of Lairdal. They were providing us mannequins so that we could like reach out to as many participants as possible across the country. We had quite a few senior educationists who tried and through various societies helped us to conduct various workshops across the country. So that's how we reached out to many people, and each time people wanted to learn more, And so the faculty development program became a flagship. That's in fact our lifeline. So every year we kind of manage to, have some key milestones. So as you said about the IPSS fellowship, so the first 5 years was all about stabilizing our base. And then we realized that, we need to make it much more stronger. So Gitanjali is in fact our first IPSS fellow from India. And she has brought in a lot of changes towards our country in terms of facilitating and encouraging more fellows, and taking the training and the research aspect of it simultaneously forward. So we are hoping one day we'll have the fellowship here as well, which is more a regular thing.
Yeah, that's incredible. It's a lot of dedicated work and creativity too, to get this going. This is like amazing. And now you also did some kind of tele simulation. I remembered I was invited to one of them because in technology in simulation has also exponentially grown. Tell us a little bit more about that.
Okay. So, as you know, Elaine, in 2020, we all went from simulation trainers zone 5 to zone 0 because we didn't know how to do distance simulation. And I think that helped us. We all regrouped. We still wanted to reach out. So we conduct some events called Simulathon, which is like a marathon of events across the country. We get whoever are the simulation educationists, we share scenarios, we ask them to conduct in their own centers, we share the lessons, we bring about some system changes. It's somewhat similar to how SSH does their SSH week, the annual week. So we kind of, started that in 2013, 2016, 14 or 15, we started our simulathon. We initially started with trauma as our theme, and then sepsis. And then for COVID, we did our COVID simulathon where we kind of, looked at what was the system changes and everything. This was also a time where Zoom became very popular, and we were able to connect. So with the distant experts, we became much more familiar. So there were much more closer and faster growth of connecting with the international experts. And we had a lot of stimulation and inspiration to develop simulation locally. My colleague, Dr. Ibo Jacob, was also the past president of our PediSTARS and is also an IPSS fellow. As a part of his project, he did distance simulation where he was able to demonstrate the improvement in patient outcomes for sepsis. And that has even won quite a few awards. So that's how our telesimulation journey started. The focus was, how do we ensure we are able to conduct simulation locally? How do we make sure that whether there is COVID or not, we continue our training? Nothing should stop us. And then we focused a little bit on research aspect of it. So these were like some of our footsteps towards telesimulation.
So how is simulation integrated into the training curriculum now? With all these growing pains and the naysayers and like struggles, what is it like in the teaching learning curriculum? Okay, nursing for doctors in India.
Yeah. So one thing which we did upfront when we started our faculty development program was, we knew that nurses will not be integral to the simulation upfront if we charge them, but at the same time, they are needed. We want a multidisciplinary approach. So from the first faculty development program course we did, we said the doctor can come, but the nurse from the same institution has to be registered for free. And that's how we integrated our multidisciplinary simulation training course for faculty. So the initial first 2 to 3 faculty developments we did, it became more of a, oh, I've attended this 2 days workshop, I can call myself a simulationist. That wasn't something we intended. And when they went back, it came back to the same practices. So we had to make sure that simulation is practiced by these faculty people at their bedside. So we made sure that we integrated something called a 3-level faculty development program from 2018. So the way it started was, so in the first faculty, the first 2 days hands-on workshop, and then, within 6 months, they will conduct at least one scenario locally in their own center, bring about system changes, and that gets mentored through senior mentors. And then they do something called level 3, which has an integration of research project in it. They develop their own scenarios, they bring about the system changes, and they kind of learn how to appraise an article and bring about a change. So, and that has been through the years, we have refined it and refined it, and now it has become part of our faculty development program. So nurses, in fact, for the last couple of years, are more or less equal or more in our faculty development program. So nurses are our pillars, and they have participated in the faculty development program, and they have like gone in. Now we have a separate workshop that is led by the nurses only, which is called the SNAP workshop. So that is how we have integrated the nurses into our simulation training. And the faculty development program, in terms of the education, is, I must say, our faculty development program is one of the most coveted program across India, and we always have a waiting list. The first workshop that gets lapped in no time is our faculty development program. So people do see value in it, and then bring about changes at their workplace.
And I would thank you. There's a snowballing effect, right? It's not nurses in pediatrics, but in midwives as well, and techs. Everyone who's involved in the care of children is welcome and can participate. And then they'll take it to their own institutions and carry on doing what they need to do at their own places. Wow.
So as Pediatric, in the last 3 to 4 years, has branched out into multi-specialty. So we now have surgeons, anesthetists, gynecologists, everybody attending our faculty development program. And this year, because we recognize we don't have the technician course as such, this year, with the help of Dr. Pooja Nawate, we are launching our first, operation specialist course. That's called Master. Yeah.
Ah, right. I did hear about that at the last IPSS W. Now, so let's change gears a little bit. It's amazing. 10 years plus of hard work, sweat, frustration. I'm sure a lot of growing pains. We're all low budget, low resource. Doesn't matter where we live. What advice do you have someone who's starting out in their own place? Yeah.
So the first thing is, you will always have naysayers, but you'll also have people who are like-minded. So first, identify your friends, who they are, and define the problem, whether you all have the same needs. Okay. And then come up with solutions that will help you. Network with similar countries that are going through similar issues. Network with seniors, network with IPSS, network with SSH. Make sure that you have a needs that is defined. You have the entire world coming to your rescue, coming to your help. There are such fantastic people across the world, and especially in IPSS, who will actually spare their time and support the movement in your country. So all you need is to identify, define it. And the first few years will have growth pains. It is better to accept it, be prepared for it. And then you need to develop that. So that's how I would kind of start that. Because and then there is so this year when I came to the IPSSW, I recognized quite a few countries, such as people from Argentina, from Brazil, from Singapore, from quite a few places they had come, Pakistan, India. They all had similar kind of footsteps. They all were in the same situation where I may not have these high tech mannequins. I do want to bring about a change, and how do I do that? And I would seriously recommend to all of them to start with small steps and integrate and do a needs analysis for your own country. Come up with what is it that you want to achieve, and forming some societies such as what we have done called PediSTARS in our country, maybe something similar in your country, so that you get a national recognition for it, and then you have the similar interest people joining in into that society. You can affiliate with international bodies and affiliate with various, like for example, taking the help of IPSS fellowship, or inspire and attending them to understand what is going on right now, and then developing it. So that's what I would recommend seriously, but
One
be
of the
prepared for the hard sweat.
Yeah, one of the things you started with was resuscitation. I think that's like an established protocol and probably a pretty safe place. No one can really argue with the PALS protocols if that's all you're practicing. Maybe start there, because I find like talking about latent safety threats or patient safety, not that they're not important, those are more challenging topics to tackle, aren't they?
Correct, yeah. So I think a few things that is slightly different, and nowadays in the resuscitation courses such as PALS, they're integrating simulation. They're talking more about the realism and also the debriefing methods. They're integrating it, making sure that it's a safe learning space. So I think these are like some of the things that can be done. We in India have focused that, there were many people who said, we don't have mannequins, we don't have any support from our institution. How are we going to conduct simulation? And so we came up with lots of innovations that will help us to do with bare minimum that we have, to ensure that we are still conducting the simulation. Learning goes on irrespective of what happens, and we focus more on the low tech and the in situ to make sure that the requirements are not very high. So I
Yeah, I
think,
remember you.
yeah,
Some of your members have brought in like dolls that you buy at the market. That would serve the purpose for whatever it was trying to do. Um, and also, I think the great thing is that because it's coming from educators in your own country, you can translate to fit the culture and be more respectful of the learning environment. That I would never be able to imagine what it is like. Um, I could work with you, but never mind. Then your local champions can just make that more reasonable for your learners. And as you say, maintaining the psychological safety and make it real for them as well.
yeah.
Now, last thing you did at IPSSW, I remember you were so excited, was that trying to create this LMIC group. Uh, Tell us a little bit about that.
So basically, when we came, I met quite a few colleagues from other countries who were not as advanced as America is, and they felt a little overwhelmed in terms of looking at the abstracts and the content that was presented, and they felt that, what can I take home? How am I going to implement simulation in my country? How do I handle the naysayers? And what can I do to come up with low cost innovations that will help us implement simulation seamlessly in our countries? And they needed some solutions there. And I thought that probably when we have similar problems, maybe it's a good idea to form a LMIC group and then start working towards our needs assessment, and then work towards our innovations. So I think we need to gear up towards that, and then make it more focused towards LMIC. As I understand, Sisam and David Grant, and probably even Gitanjali is involved in it. Couple of colleagues from South Africa are involved. They have done a LMIC survey globally to try and understand what the needs assessment of these are. So we are curious to see what their findings come out as. And I do look forward to a setup wherein there will be a venue or a place where a forum where global experts can share lessons and inspire and motivate others, especially for countries that don't have simulation in their setup. And that is a large part, actually.
That's incredible. Well, thank you so much, Sujatha. I've thoroughly enjoyed knowing what actually happened in the beginning days of PediSTARS. And of course, it's lovely chatting with you as always. So thank you so much.
Thanks, Elaine, for the opportunity. I hope we're able to inspire quite a few people. And thank you, IPSS also.
Thank you for listening to this episode of the IPSS podcast. A special thanks to our behind-the-scenes producer, the talented Denish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible. Join us next time.